living in the moment, and the moment is the future.
With Pam and John.
Welcome to Sped Talk with Pam
and John,
also known as The Calm.
Before the Storm.
Our purpose is to elevate the conversation and amplify special education resources.
And our why is all about the kids. You know, Pam, there are so many organizations and people around Texas who are just making it happen for kids with disabilities.
So let's make this a platform to celebrate their efforts, because special education is about making the impossible possible.
All right, guys. Well, I'm staring at my computer, something I do a lot of these days, but I see some smiling faces and some friends looking back at me. So I don't feel quite so isolated. So thank you guys for joining us on Sped Talk. And I see my partner in crime up there, Pam Humphrey, the amazing Pam Humphrey. She's here with us, and we're excited today. We're talking mental health. We're talking resources and how to make sure this transition back to school is one that doesn't cause more anxiety than what some of us are already dealing with, just with everything going around right now. So, Pam, how are you making it out? What's going on with you?
I'm doing quite well. I'm doing good. I'm just kind of get adjusted. We're going to go back to the office in a couple of weeks. I'm getting excited about that, trying to get away from being at home and get some normalcy. I mean, I was thinking the other day, I'm not sure when the last time I actually put on shoes other than tennis shoes. And it's like, okay, no desire to go shopping because no need to, because I'm not going anywhere, but I'm ready to kind of get back into the swing and, like I say, have that bit of normalcy back in my life. So that's.
We're heading back into school, into the office, into the world, and it's going to take a bit of transitioning, I think, for a lot of us. And so I'm excited to have Cody Martin, fellow liaison, with us, and Jeni Janek, my dear friend and counselor at ESC Region 12, and both counselors in their own rights, and just are here with us to be guests and talk about just some things we can consider going back in, things to watch for, things to be aware of, maybe in ourselves and in others. And so, guys, thanks for being here.
Thanks for having us, John. It's great to be with Region 11 with you and Jeni, and our Region 12 with you and Jeni, and then Pam, Region 11. So thanks for having us. I'm definitely not the expert here, but have been trained in youth mental health first aid, and I think it's a great training for our educators as we go back and deal with students and families that have gone through trauma that we see with COVID.
Yeah, and Jeni,
Absolutely.
I know you have a lot of background in that as well with the trauma informed.
Thanks for having me as a part of this. This is really a unique time to get to come together, but one where we can really draw upon a lot of resources and things that are surrounding us to try to help right now. My background is primarily with crisis response and working with school districts in the wake of loss, usually in tragic situations. So the nature of this crisis is a little different, but there are some tenets and things that can be applied that are somewhat universal. So I'm looking forward to kind of sharing those and just seeing how we can help everyone get back to school in a healthy and safe way.
Absolutely. So Pam, do you have any kind of, what's your background with crisis or trauma? You ever dealt with any of that?
I try to avoid them.
I think we all do.
I think, to be honest, not really. That's not my background. So I'm very interested to hear, what the state has put together. And so I'm more of a listener today, John.
Yeah, I know. It's one of those things. Trauma informed and responding to crisis is something that you don't think you're going to find yourself doing when you sign up to be an educator. You don't think that you're signing up to go in and try to comfort a student who lost a parent or a grandparent or but these are things that touch our lives every day, and I think for some more so than others. And so it's wonderful that we are taking a real look at mental health in Texas again, that we're really focusing on the whole child, on more than just the academia and the reading abilities and such. I mean, that all is important, and we want kids to have bright futures. But, they got to feel loved, and they got to feel nurtured, and they got to feel connected. Those are the things that I think that we do as counselors, is we just let people know that they're okay right where they're at. And so, it doesn't take a trauma to care about somebody and to be kind to someone. And so, but I am interested. I want to pick Cody's brain here in a little bit about that mental health first aid. I've never done that program, and I've always heard such great things of it. But jumping in real quick, Jeni, I wanted you to talk a little bit. I know you're pretty involved at the state level right now with a lot of things that are going on.
Yes, I'm on the mental health task force that is from House Bill 906, where we are. And interestingly enough, this was an initiative that came out of the 86th legislative session before dealing with COVID-19, before what can probably only be said at this time in 2020 as a multiple trauma event. There's a lot of big things that have been happening that have had impacts on everyone in our daily lives. And people are going to be taking that in and dealing with that in different ways, students and staff. And I think what I'm excited about in terms of our perspective kind of having a shift is that with multi-tiered systems of support, MTSS, and our social emotional learning awareness, in those two components right now, we're involving more of the adults. I think in education we tend to always say, do this, it's best for the student, do this, and it is. It's absolutely our primary focus. But I think we're starting to have more educated conversations about what's good for us as adults interacting with kids, and how we, the oxygen mask that we put on first in the airplane whenever there's something going wrong, then taking care of the kids. I think we're trying to incorporate that into our intentional efforts with meeting social, emotional, and mental health needs for students, and that ensures health for all of us when we do that. So that's an exciting thing that we're working on with those two elements, and a lot of things are coming out of that to help with students going back to school and teachers going back to school right now.
That's interesting, because sometimes we think, well, we really don't think so about the teachers as much. Now, granted, with COVID, there's been a lot of focus on teachers going back and their level of concern about going back into the classroom. I think even prior to COVID, I think sometimes we forgot about the fact, teachers are like kids in a way that whatever's going on at home, it comes with them in that door. We're not capable of just shutting down and like robots and say, okay, now I have to teach, so therefore what would bother me before I got to the door has ended.
Yeah.
That whatever the social or the emotional issues that I have, I'm going to bring them into the classroom with me. And so I think it is important that we do focus on educators and also their stress level during this time.
Yeah, a healthy teacher equals a healthy kids, and I think that when we have teachers that feel safe and feel, anxiety, nerves, things like that, that's the normal part of life, but when we have systems in place that really create that climate, that culture, that of acceptance of, look, we're good here, we're safe here, there's someone you can talk to, there's always a place to go, no one's trapped, no one's, I think that translates down to that student level. And so it is neat to hear that we are paying more attention to our teachers, to our educators, to our, our whole systems really, versus let's just focus on that child and try to fix this, versus let's look at the entire system and create the type of system that provides those supports kind of at the multi-levels, like you mentioned, the multi-tiered systems of support, that MTSS. Mm-hmm. Well, Cody, tell me a little bit more about that mental health first aid. I mean, I know Jeni knows all about that. I know I've talked to a lot of people. I've just never in my career, I can't believe I've never actually had the opportunity to attend that course.
Well, I'm lucky to be a trainer in youth mental health first aid. It's something that our team here at Region 14 connected me to because of my background in counseling in the schools. And I think it's just a great training to take our educators through, because it really gives you some great tools in your toolkit to help students who are going through a mental health crisis or going through trauma, and to be aware. And one thing that's great about being a liaison, I'll go on that part, being with y'all today, is being able to connect with Jeni and hearing from her all the great things we have going on at Region 12 and across the state, because that is our job, is to connect resources to help improve outcomes for students with disabilities. And as a liaison here at 14, being able to be trained in that, also hearing from educators, being able to connect them to our experts here at 14 in behavior and trauma and school safety. So yes, that training, I try to volunteer as much as I can to do the training. I know that when you get certified to train, to keep your certification, you have to do it at least 3 times a year. We're fortunate in the Region 14 area. We do have many educators trained in school districts as well to support schools out there. So yes, and I think, and Jeni I can ask her this, one thing that really sticks out to me, no matter what it is, youth mental health first aid or connecting with kids or is building relationships. And that's a big key we stress, and that sort of goes along with the youth mental health first aid training, is building those positive relationships with kids so you know where they are, where they're coming from, and if you notice something that, is not just, you've built that relationship with the kid and you can just tell they're going through something. I think that's the biggest push too in this training, is just awareness and giving that message of building those positive relationships so you can reach out to that student and give reassurance to them, listen to them, and also help them as an educator connect to resources, professional resources, or just individual help that can help them. So yes, it's a training I love to do whenever I have the time as a liaison. And I'll let Jeni, am I sort of right on the same page, Jeni? Is that what you see in it? It's a big part about building those relationships with kids so you know where they are and what they need if they're going through a crisis.
Absolutely. And right now, that's probably a center stage focus, I would say, for us in education. We don't always think of education and learning as being personal, and yet it is. And I think it's George Washington Carver that said all learning is understanding relationships. And so whether that's a personal connection or it's a connection to what's being taught, youth mental health first aid is a great way for us as adults to understand that perspective of what our youth are going through, and whether it's maybe a clinical diagnosis for a mental health condition, or there's something that is situational. Right now we can see students coming to us or families interacting with us who have dealt with economic hardships, the exposure to COVID-19 from a family member, or the experience of having COVID-19, and the stress level for the period of time that we've had to endure the crisis absolutely is going to have anxiety skyrocket. There was a CDC briefing that came out just recently. I learned about this from a medical doctor that I know really well, and she was very floored to know that about roughly 25% of young adults right now, age 18 to 24, have had serious contemplations of suicide and self-harm on a daily basis through the pandemic. So with that population and the stressors that go with that, it is highly likely that we could see some very high stress levels for some of our students coming back. Maybe not all of them. I do believe we're going to see a lot of resilience, and in crisis work, that's one thing that I can count upon. There's going to be some interaction with the student that will just blow your mind for what they're capable of taking in and thinking about, and they'll say some very profound things. So the resilience is going to be there. But for students that might be compromised with stress and anxiety and depression, it's going to be really important that we have good training, good access to resources, so we can help them and take care of one another.
Yes, exactly. And one thing that sticks out to me in that training, being a trainer too, is it looks at stigma, not labeling those kids, and thinking that it is a training that gives educators hope. We stress that there's always hope for recovery and for help out there to overcome and be successful, because as we know, there's a lot of people that have been through trauma, a lot of people that have been through difficult times that are very successful, and there are things out there that we can connect them with as well as educators to give them that hope. So
such a positive
yes.
point to make is that hope, right? I think we always have a tendency to want to manage situations and the logistics and plan for the worst so that we have something in place. But we can't forget to really kind of hinge ourselves and just kind of focus our efforts on that hopeful belief that things will, that good will come of this, that we will be better for this, that and then to try to find that empathy for one another, and then through that just share that hope with others. So I know so many educators across the state in different capacities, from the classroom teachers and to some of my friends who are janitors and bus drivers and special educators and general educators and principals and superintendents, and I think it's such a mixed bag of emotion that's going on around the state when I talk to folks right now. Just the unknowns, not quite. But one thing that has resonated now that you mentioned that hope a minute ago was just that hopeful nature of just getting kids back to school, even if it's remote in some instances, but having kids doing school and having educators kind of pulling those strings again, making things happen. And so there is a lot of real positive anticipation right now I think across our state and probably across the globe. Let's get things going. Let's get kids learning. So what are some things we can do? Like, what are some things we can be aware of, maybe to help adults, as they transition through this, as well as our kiddos trying to make their way back into the classroom?
I think that one of the things that I had a conversation recently with some of the counselor folks who are going back into educators, just in general, is ensuring that we help our kids and help one another understand that we are going to interact with and come in contact with people who have had personal experiences with COVID-19. And I worry from, I guess, a standpoint of social acceptance, the social emotional aspects for students who have experienced that. And you don't want kids to feel isolated if they've had a bout with COVID-19 or if they've had a loved one in their family, because that stigma behind the disease, and it's a scary disease. We understand certainly why there's that fear, but really trying to have the message of accepting people and that what they're experiencing does not define them. And we know there are children who are going to have those experiences and then be at some point welcomed back into their classroom environment or setting, whether it's online or in person. And I do hope that that is something we kind of do keep cognizant about how we help our kids and each other if we've come in contact or experienced having COVID-19, because I do fear that could be a focus in a negative fashion. So I've got that in my mind a little bit.
Thinking of ways to take the right measures to keep people safe and not overreacting or even turning that into negative, almost ostracizing people because they got sick for some reason.
Yeah, and I think that's great what you said, Jeni. Also just being aware of, that some people may have gone through something like that. You just don't know. So awareness is big as well.
One thing I was thinking about, because I have a friend who's working with some first-year teachers, and just the stress, just their high level of stress, because some are doing remote and in class, and while others just doing total remote, and just feeling overwhelmed by can you picture your first teaching job, and you're facing COVID, and and trying to manage a remote as well as face-to-face teaching, or just go totally remote. Just that anxiety level. I mean, you would have it naturally as a first-year teacher, but just think about how high it is under this situation.
Can't imagine. My wife has a good friend who's an educator, and the name I'll keep out because you may not want me bragging on her, but she had not, she had stayed home with the kids for a few years and done some different things. And my wife said, well, so-and-so's going to go back to teaching this year. And I went, what? Like, of all the years, but she felt called to. She, because of what you're saying is like, it's just, she just wanted to go back in and be one of those grownups that could be there managing that stress and those nerves, and maybe because she had some experience but it is a stressful job anyway. Education is not an easy gig, and so especially not to get it right. And those first year babies right now that, oh my gosh, they are ready to go change the world, but they don't even know what world they're living in right now. So there's just a lot to focus on, and I think that's where having our administrators on board, having our campus leaders, our district leaders really focused on creating that feeling of look, safety and warmth and preparedness and proactivity regarding so many of these circumstances. And, you know, we can't guarantee anything and we can't prevent everything. But we can take measures to ensure that, you know, we're putting some common sense in place and we're keeping people as safe as they can. And we all have to kind of each do our parts. Heard my grandfather clock back there.
Yeah, I was like, whose clock is that? But I wasn't going to say anything, John.
Boy, here we go. Good thing is I can edit this stuff. So sometimes I do, sometimes I don't.
Now, Jenny, you had mentioned about the tenets of the training.
Well, Youth Mental Health First Aid is, in its original form, is an 8-hour-long training. There is a abbreviated version now. I think that the Youth Mental Health First Aid is a national, worldwide recognized training. And if in a face-to-face environment and going through that, there's probably 15 to 20 different activities that you could choose from to teach different concepts and to help people understand diagnoses, to understand symptoms, to understand what it's like to possibly experience something like an auditory hallucination. I know there's an exercise within the training where there's a simulation for that, and it's very enlightening when someone goes through that, and from that point on, you have a different understanding and respect for a person who is dealing with a potential auditory hallucination or a mental health crisis, and definitely what to do and how to interact, to ask the question, to be able to really muster that courage when you're face to face with a person who's struggling and they are giving off all the signals that they could be contemplating some act of harm, to be able to ask them if they've had thoughts of suicide or thought about killing themselves. And it's a hard question to ask. It's really hard to ask. So having that mental preparation, the training and the experience for that, and even in this day and age, to know when to go past that. If you just aren't comfortable with the response that's given, if a person is given the signals that they're in danger, knowing how to collaborate with professionals and seek additional consult, and how important that is. It's extremely important given our current rates and even the rates before the pandemic hit for teen suicide and loss to suicide. Those have always been terrible numbers and even more so alarming now. So those are the kind of things that are discussed within Youth Mental Health First Aid training. And there are virtual options now, blended in virtual options, and anyone can go online to find them, to be hooked up with an instructor and get the training that they need.
Yeah, you know, I think that's, you know, a lot of times I think educators just need to know that it's okay to act, and this type of training would probably enable them to, I think, be more responsive to some of those concerns or some of those things, those signs they may see that before they might have felt like, well, I'm not trained or I'm not equipped or I'm not the right person to, you know, and maybe they're exactly the right person to initially act, even if it is to then get that child or that student or that friend to someone else that they feel is more qualified.
Right.
Yeah, I see we lost Pam too. I don't know if she might have, you know, listen, Cody knows this. She might have just given up on me. You know, she might have said, like, I'm out of this thing. This SPEDTalk.
No.
No, we'll probably see her popping back up. I bet she had some bandwidth stuff going on. But, well, you know, it's kind of, you know, prior to the pandemic, you know, you think about the last couple of years, you know, we had some significant things going on around the state or just around the nation, even with, you know, school shootings and just the safety of schools. And, you know, so, you know, the pandemic, I guess, was on this whole other level of, you know, upending kind of the world and as we know it. But, you know, it's in some ways, some of these other ideas, these other problems kind of fall off our radar when we have these big things happen. And so I wonder, is there action still moving, you know, as far as some of these other initiatives that were in place before? Jeni, maybe you could allude to that a little bit.
Well, absolutely. There's Senate Bill 11, which was a huge bill for school and student safety, had several different elements in it, and a major focus for that was behavior threat assessment And the term behavior was added to that because there are so many things that can be happening to an individual who's had either suicidal or homicidal ideation. And sometimes those things are in conjunction. We know from research that an individual who may be experiencing a mental health crisis and having homicidal ideation could also have suicidal ideation. And the behavior threat assessment teams are still expected to be intact for schools, and that there needs to be a very diverse representation of participants on those teams. And there has to at least be one per campus. There's a school safety team for the entire district. And that the premise and the hope for that team is to try to intervene appropriately based on reports or any activity that alludes to a potential act of harm, so that individual who is a person of concern can get help and can have an intervention long before there's a punitive or catastrophic event that occurs. So that is a big and continually a developing aspect, working with the Texas School Safety Center and with other entities to ensure that work is going on. And then also in terms of safety, if we were on that for crisis response and prior initiatives for student safety, is human trafficking prevention and intervention. That's a big push out of the governor's office. At Region 12, we've been working with the governor's office liaison, team of liaisons, to help with what's called asset mapping, where we are going to try to help our districts and our counties understand how they can have good contacts and relationships with child advocacy centers, their local mental health authorities, with hopefully strong established contacts that they can be liaising with routinely, so that students or individuals who need that help can get it before it becomes a dire or crisis or some terrible type event that happens. So those are two things that have been going on and will continue this year.
I mean, I was going to ask Cody, what do you all have going in Abilene?
Well, of course, I'm not the expert, like I told Jeni before the show we started, I for sure can connect you with Rod Pruitt here at Region 14. And the team that is around him now, they are very knowledgeable, like Jeni, and I'm sure Jeni has worked with some of them as well across the state. That's one good thing about, like I said, about being liaison, is getting to just hear Jeni today and the things she's sharing. But for sure, I know she would stress and I stress sort of putting in that liaison as I'm training for youth mental health first aid is always, I've always heard the term that Texas is very resource heavy. We just need to use the resources that are out there. And like Jeni just said, some of the amazing resources that they're, trying to connect families with some of this stuff is amazing, and it's out there. We just got to use it. And so I do stress as a liaison wherever I am, I know John, you and Pam do the same thing, is if you can't remember anybody's name, remember my name and I'll connect you to the person that you need to be connected to. So that's mainly my job, other than the trainer in the youth mental health first aid, is to connect those educators across Region 14 to Rod Pruitt and his team, and show them also the resources. I know there is a time in youth mental health first aid training that you can show them the resources that we have available, that we do pull up as we're going through the training, that can connect educators to the service center, and to also connect them to other resources that we have in our community and also possibly in their community. But Abilene being the largest city in our area, that's where most of the resources are, but also there are other resources out there in other cities and counties as well. So that's a big picture I want them to know, is just ask is the biggest part, and let us connect you to help that you need. And I don't know, Jeni, one thing that I stress too is, 211 is a number that I used when I was a counselor in schools, or pushed out there. And I know we need to push that out there because it's a great number to call. Just never think that you have a stupid question, or you can't get help for that. I say reach out to somebody at 211 or whoever and let them connect you and get you connected to the resources you need.
Absolutely. I think that with one thing that's going to probably come out of this situation with the pandemic, and I've seen this kind of as a collateral phenomenon, is that a lot of our schools really dove into making sure that their websites and their digital communication with their families was much stronger. And it's because it had to be, but my hope is that that continues, because it means that the more beefed up and the more robust that those websites and those digital communication options are, the more we can continue to share those things with our families. And the pandemic forced us into that situation, but I'm thinking it's probably going to stick around, and it should, because we rely heavily on that means of communication with our families, and 211 other resource opportunities. There's just almost going to be a tab on everybody's school website that'll have hopefully these local resources for them, maybe some state and national ones as well. But that's how we have to help everybody be aware of what's out there.
And Jeni, it seems like I heard, like as part of, I think it was at Senate Bill 11, that we're gonna have additional mental health, I guess FTEs, maybe even linked to service centers in the future, maybe, or something like that.
Well, in House Bill 18, there's the mental health
18.
liaisons. It's 19 is technically what the mental health liaisons, and that's still developing. I think that probably would have gone through a little faster had the pandemic not kind of slowed down some developments there. But several of the ESCs do have their local mental health authority or the non-medical professional health liaison who's with them now. And an interesting thing when we talk about asset mapping is a lot of times the maps that we have for our service areas don't always align. So within our region, per se, we have 12 counties that we serve school districts in, around 86 school districts. And our liaisons with local mental health authorities, the one that's in my McLennan County, has only 6 counties that they liaise with. And then there are 3 other local mental health authorities who cover the entirety of my map. So that means that I have to know, or my liaison coming in needs to know who all is able to serve all 12 of the counties that we serve, so that I can make sure all of our schools are covered. And we've been noticing that with Health and Human Services or the Child Advocacy Centers, the maps don't always align. So it's important to be able to lay those down on top of each other to say, okay, who would serve Navarro County, or who would serve my Mills County schools or my Bell County schools. And a lot of times districts don't have time to go fetch a lot of that data and a lot of that information. Right. And when we can strategize like that, which is what we're trying to do, we'd like to think that helps them start those bridging processes and start those relationships with their organizations.
Yeah, I think it's another great example of just forming those connections and making sure we don't have any of those, those blind spots, those places, those areas that we just thought, we assumed were covered, but we hadn't attended to this relationship or this relationship like we had maybe one central relationship.
Right.
That's a great point.
So Jeni or Cody, either one of you, with teachers going back and students as well, what would be one thing you would share with them?
I mean, going back from remember I'm a trainer, going back to my training is you've always got to remember to take care of yourself too, because you have also gone through some trauma as well and some things. So always take care of you, and know, like Jeni said before, the training does, take you through some things, talk about, know your limits and know what you can do as a person trained in youth mental health first aid, but know there are people you can reach out to. But always, just like everybody has done, like I know y'all have done it too. We have done some things during this time just to mentally take care of ourselves, and don't forget to do that as well as you go back into teaching. So that's my input, Jeni.
I think that is a perfect segue into what I was thinking, and it was along the same lines, of course, self-care. And one, I just got through visiting with some of my counselors here this morning in a Zoom, the summer send-off, and I talked about just the things that you can do. It feels so many times in a crisis or in multiple crises like we're experiencing right now, it feels like there's things we can't do or can't deal with. And to be empowered, we are going to have to look for what we can do. So maybe that means that in your environment, you are focusing on some aesthetic things that are welcoming, that are warm, that are comforting. In crisis response, we learned that senses really are important to pay attention to. So things you can see, things you can hear, maybe smell or touch, whether it be anything from soft lighting to soft music to certain times that you have control over your little environment, that can help bring some stability and comfort. And just the things that that bring that help for trying to minimize or alleviate some of the anxiety and stress as you take care of yourself, because that will translate. Your kids and all the people around are going to feel your energy on that. So self-care, I appreciate you leading off with that, Cody, because that's exactly where I was going for intentional ways to help come back to school and make it enjoyable.
Yeah, I know educators are not always the best at taking care of themselves. They're so busy taking care of everybody else,
And we're fixers by nature.
We're
We want to fix it. And believe me, we all want to fix it and make sure everybody around us is taken care of. But you've got to remember too to take care of yourself, or you're mentally going to be so stressed that you can't take care of others as well.
Yeah, I agree with you. Well, Pam, you got anything else you want to throw into this episode?
I don't think so, John.
There's going to be some bumps in the road. There's a lot of unknowns, but we can do this. And together as a state and together in our schools, like, we've got each other's backs, So I think lean on one another and put one foot in front of the other, and it's going to be all right.
Well, it was an honor to be in the presence, although it's via Zoom. But that's another great thing about Zoom is I got to meet Jeni for the first time. And so, although we're not in person, and to hear her and know all the great things that are going on there at 12 as well, and a remarkable job about getting those resources out and helping our educators across the state. That's awesome. So thank you for having me with y'all today. I sure appreciate it. And know that as we get started, just, be aware, encourage each other, take care of yourself. And I know that the kids are lucky to have either in person or via Zoom to have educators out there to be with. So
amen.
Yeah. Well, thank you, Cody.
Yeah, Cody, appreciate you, bud. Appreciate you coming on. Like, you've been on several times with us. You haven't turned us down yet. It's a good thing.
Am I are y'all desperate or something? Do y'all go through the last? We'll just ask Cody to be with Jeni.
No, and I'll tell you, Jeni, I want to give a shout out to Jeni too. Jeni's my dear friend, man. I called her for years back, and I hit her up at the last minute yesterday and thought, if I could get Jeni on, that would be fabulous. We really appreciate it.
And all of you, Cody, thank you for your kind words as well, and to get to be here with all of you. It's wonderful to have this conversation and to know we do have so many partners in the state. We're all working together, and I think that is probably the most beautiful thing about this, that the resilience and grit of Texans is never to be underestimated. And and I see that in our schools, our communities, and definitely among our ESCs and at the state level as well. So we're going to rise up. We're going to be able to make it.
To continue to elevate the conversation, hit us up on Twitter at SPEDTalk 2020, where you can find links to all of our episodes and each of the resources that we discussed today.
John, also links to the resources will be available at our podcast site.
And if you found these resources helpful, be sure to share them with a friend, because information should always flow through us, not to us.
That will do it for this episode of SPEDTalk.
And remember, courage creates culture and kindness keeps us connected.
Until the next time, I'm Pam.
And I've been John.
And this is SPEDTalk.
Living in the moment, and the moment is the future.
With Pam and John.